Inflammatory bowel disease, IBD, is a term used to describe disorders that involve chronic inflammation of the gastrointestinal, GI, tract. The two main types of IBD are Crohn's disease and ulcerative colitis. Crohn's disease can affect any part of the GI tract from the mouth to the anus, but most commonly affects the end of the small intestine, the ileum, and the beginning of the colon. Ulcerative colitis, on the other hand, is limited to the colon, large intestine, and the rectum. The exact cause of IBD is unknown, but it is believed to result from a combination of genetic predisposition, environmental factors, and an inappropriate immune response. Several risk factors are associated with IBD. These include a family history of the disease, which suggests a genetic component, and age, as IBD is often diagnosed before the age of 30. Additionally, ethnicity plays a role, with individuals of Caucasian and Ashkenazi Jewish descent being at higher risk. Environmental factors such as diet, smoking, and the use of nonsteroidal anti-inflammatory drugs, NSAIDs, can exacerbate symptoms. Interestingly, urbanization and living in a developed country also increase the risk, potentially due to lifestyle and dietary differences. Symptoms of IBD can vary widely depending on the severity and location of the inflammation. Common symptoms include persistent diarrhea, abdominal pain, rectal bleeding, weight loss, and fatigue. Crohn's disease might cause inflammation in patches and can penetrate deep into the layers of affected bowel tissue, causing complications like fistulas and strictures. Ulcerative colitis typically involves continuous inflammation of the colon's innermost lining and can lead to complications such as severe bleeding and perforated colon. Treatment options for IBD focus on reducing inflammation, managing symptoms, and achieving and maintaining remission. Medications include aminosalicylates, corticosteroids, immunomodulators, and biologic therapies targeting specific pathways in the inflammatory process. Lifestyle changes, such as dietary modifications and stress management, play a supportive role. In some cases, antibiotics are used to treat secondary infections. Despite medication, some patients may require surgery due to complications or when symptoms are refractory to medical treatment. Surgical management of IBD depends on the type and severity of the disease. In Crohn's disease, surgery might involve removing damaged sections of the GI tract and reconnecting the healthy sections, known as resection. Strictureplasty, which widens narrowed sections of the intestine, is another option. For ulcerative colitis, the most common surgical procedure is a colectomy, which involves removing the colon. This can be followed by creating an ileal pouch anal anastomosis, IPAA, allowing the patient to pass stool normally. In severe cases, a permanent ileostomy may be necessary. A comprehensive nursing care plan for IBD patients involves monitoring and managing symptoms, providing education on the disease and treatment options, and offering emotional support. Nurses play a crucial role in administering medications, monitoring for side effects, and managing nutritional needs. They also assist in postoperative care, particularly in patients who undergo surgery. Educating patients on lifestyle modifications, such as stress management techniques and dietary changes, is essential for long-term management. Emotional and psychological support is vital, as living with a chronic condition can be challenging. Inflammatory bowel disease is a complex and chronic condition that requires a multidisciplinary approach to manage effectively. Understanding the types, causes, risk factors, symptoms, treatment options, surgical management, and nursing care is crucial for improving patient outcomes and quality of life. Early diagnosis and comprehensive care can help patients achieve remission and lead fulfilling lives despite the challenges of IBD. Subscribe to us for more videos like this and visit bazaarbiblio.com for notes and free PDF books. Thank you.